Good morning, all. It is my great privilege and honor to introduce today's distinguished speaker, Dr. M.R. Vasudevan Nampoothiri, sir. Welcome, sir.
Thank you, Dr. Adithya Panicker, for giving me a chance to participate in the fourth series of this seminar. Due to some technical delay, we lost almost 10-15 minutes. That doesn't mind. Let us start. Let us go to the subject directly.
Okay.
First of all, a prayer to the priest. Can you next slide? Namami Thanandiri Madidevam Surasureru Vandida Padapatmam Loke Terari Mruttinasham Atharamisham Divithosatiram. Namami Thanandiri Madidevam. Let us salute Thanandiri. Then let us go to the subject. Next slide. Our spine is a wonderful combination for between stability and flexibility, because we have to get good stability and at the same time we have to keep the flexibility also. You see, there are two major joints in our body. For example, one joint is shoulder joint, which is having more flexibility and more range of movement, but its stability is very poor. That is why we often deal with this shoulder dislocation. The other major joint is the same type of joint is hip joint, but it is having more stability, but its flexibility and range of movement is minimum. That is why this hip dislocation is very rarely seen. But in the case of this vertebral column, both flexibility and stability are there. That is it's a wonderful compromise between opposing necessities. The intervertebral disc is a marvel of nature and serves useful purposes, because it acts as a bush for the vehicle, like that. It is act as a what we call this. It is acting as a bush, and it reduces the compression. Development of various curvatures of the spine is an attempt of nature to economize on energy expenditure and mechanical stress on the spine. Next. You see, there's a very common disease called tennis elbow. It very rarely happens with tennis or tennis, but it is a 1 minute. It is actually a presentation of cervical spondylosis. We rarely miss them. Hence, the cervical spondylosis and lumbar spondylosis appears in various forms in our body. Hence, we should be very careful in making the diagnosis. Pain caused by irritation of one spinal root may extend in some cases in more area, because at that time it may be very difficult to recognize also. Moreover, the average weight of our head is almost 6 to 7 kilos, which means that our neck muscles has to be strengthened to hold this weight always when we are standing, when we are sitting, whatever we are doing, except on lying. We have to hold the head, for which we have to strengthen our neck muscles. That is very, very important. See this picture. Next. See this picture. This shows the anatomy of the spine. Various vertebrae are there. Then intervertebral disc we can see. You can see the curvature of the thoracic curvature, cervical curvature, lumbar curvature. Sacrum also is having some level of curvature. All these things we can see. This is the normal anatomy of our vertebral column. Next. See, these are the abnormal stages of our disc. First, initially, of the top part, normal disc can be seen. Then we can see the degenerative disc. Then we can see the bulging disc. Bulging disc, you see, it is bulging towards the nerve endings, which may cause some pain and other problems. Then, when the disc is more damaged, it gets herniated and it causes more problem. Then thinning of the disc, which is usually seen as a sign of degeneration. and osteophyte formation, which is also severe severe degeneration. We can see osteophyte formation, which can be considered as very chronic. Next. See, when we do the usual works, when we do some homework or when we are taking one book from a shelf, or when we are sitting, various levels of strain is happening to our lumbar muscles and the cervical muscles. These are recorded in this picture, which means that when we are sitting on a chair, we should sit straight. At that time only the strain can be reduced. When we stand also, when we are standing straight, at that time we can reduce the strain of the muscles acting on the various parts of the vertebral column. Next. See, this is a prayer. Virivabhyasta ushligabhya vigasabhyo anukyan yashmam doshanda mamsabhya bahupyam vivrahamite. This means that this is a prayer offered by rishis to the god for removing our diseases from various parts of the body. At that time also, this griva stambha, diseases associated with the griva were there, and even at that time. Which means that this is not a new problem. This griva stambha or kadi stambha or kadi griva, all these things were happening previously also. These are all very old diseases, not a new one. Next. This spondylosis or degeneration or pain can affect two areas, neck region and lower back region. Neck region we call cervical spondylosis and lower back region we call lumbar spondylosis. You see, both are having the same problem. When Griva Graha is there, at that time, stiffness is there. In Kadi Graha also, stiffness is there, but it is in the lower part of the vertebral column. Griva Graha, Griva Shivila, Vishwachi. Stiffness, pain, and radiating pain. Both these, this stiffness, pain, and radiating pain can be seen in Kadi Graha, Kadi Shivila, and Gripsasi. This means that, the same problem occurring in two different parts of the body, but almost the same symptoms are same. The stiffness, pain, and radiating pain are seen in all these clinical conditions. You see, this is a very next slide, sir. Next slide. Tattal Lakshana Bodhi Abhyangara Vigidi Parambara Eva Paramartha Roga. Which means that, the signs and symptoms are the external manifestations of some underlying pathology. This underlying pathology is the real disease. Hence, signs and symptoms can be considered as the language of the body, but by which it is interacting with the physician. You see, signs and symptoms are the language of the body. Hence, Ayurveda is a Lakshana Shastra. Hence, we have to know what are the signs and what are the symptoms. Mere investigation report or X-ray report mere alone cannot make a diagnosis. We have to get full picture of the signs and symptoms. In Ayurveda, signs and symptoms are very, very important because they are the warning signs. Moreover, they with the signs and symptoms, the body communicates with the physician because signs and symptoms are the language of the body. This you should understand thoroughly. Next. Actually, when we go for a treatment, initially all the treatment should target inflammation, which means that treatment should target inflammation, which means that the treatment should be anti-inflammatory. Anti-inflammatory treatment, always include all the Amapachana treatment. But in anti-degenerative treatment, we have to strengthen the muscles, we have to correct the degeneration, we have to correct the position of the disc and the vertebra. By these various methods, anti-degenerative treatment works. Let us see which are the anti-inflammatory treatment. Next, sir. Anti-inflammatory treatment includes Pachana, Devana, Shamana, Aushadhas. All the don't say Devana Pachana. Always say Pachana and Devana because Pachana comes first and Devana comes only second. Pachana Devana treatment actually is meant for Amapachana. And then we give some Shamana Kashayas and everything, which is also meant for some level of Amapachana. Then all the Rucha Priyas are included in the anti-inflammatory treatment like Kashaya Thara, Levana, all those things include anti-inflammatory. Then when we go for anti-degenerative treatment, there comes Snehapanam, Taila Prayoga, application of oil, all these things, some level of Virejana, Kshiravasti, Masya, all these things comes under anti-degenerative treatment. To prevent the recurrence also, in Ayurveda, Ketau, Linge, Prashamane, Yoganam, Abunarthave, Yanam, Chaturvidham Masya. Sa Raja Arho Pishakata, which means that, at some level of Ketau, Linge, Prashamane, these are the three things. The fourth one is Yoganam, Abunarthave. Here, to prevent the recurrence, we can do Masya for cervical spondylosis and Kshiravasti for lumbar spondylosis or Padigraha. You see, in the indication of Masya, Khanannada Prasannatva Skandhagriva Asya Vakshasa Gridhendriyastu Apariva Bhaveyu Sisindina. This means that, for strengthening the muscles, Griva muscles, Masya is considered to be very important. Hence, for preventing such a Griva Graha or Griva Shula or cervical spondylosis, definitely we have to do some level of Brahmana Masya. Brahmanam Bhadave Shule, Surya Avarte, Sarakshe. In that case, the indications of Brahmana Masya is stored. Kshiravasti is mainly indicated for preventing the degenerative problems of the lower vertebra. Next. Actually, in cervical spondylosis and lumbar spondylosis, we can adopt Vata Shonita line of management. Because, Vata Shonita is not a single disease. It is a spectrum of diseases. It is a group of diseases in which, rheumatic fever, rheumatoid arthritis, lumbar spondylosis, SLE, fibromyalgia. I think I can narrate some 17 to 18 diseases which can come under this Vata Shonita spectrum. Hence, all these diseases can be managed with Vata Shonita line of management. That is why this is a group of many diseases. That is why this is explained as the last chapter of Hridaya, Nidana and Chikitsa Sthana. Because whatever diseases are not included in the previous chapters, all these diseases can be included in the Vata Shonita Chikitsa. Hence, first of all, if you want to treat properly cervical spondylosis and lumbar spondylosis, we have to study, first of all, thoroughly the Vata Shonita line of management. Next. See, there are many Kashayas and Kashayas are explained. Rasana, Buduji, Merendam, Devadari, Mahaushadam, Rasana, Panchakarma, Kashaya is there, Rasana, Sapta Kashaya is there, Rasana, Irindabala, Samaderavadi, which contains 14 medicines. Rasana, Irindadi Kashaya is there, Venadavani Babado, Rashundi, Tamrata, Darvya, Kashaya. It contains only 8 medicines. Prasarani, Masha, Belar, Sora, that is actually meant for Vishwaji, where radiating pain is there in cervical spondylosis. Then Shandar Madhurana considered to be one of the best Amahara medicine. Deshamula Haridigi, the importance of Deshamula Haridigi is that it can even be given in Amavasa, even though it is in Lega. Pravutta Shobhadhyara Mega Bulma, Arsha Amavada, Amagarakta. This means that even in Amavada, Deshamula Haridigi can be given. It is considered to be very Shobhara also. Wherever in pain and Shobha are the pain and swelling are the cardinal symptoms of inflammation. Hence, wherever Shobha is there, especially in chronic Shobha, the Deshamula Haridigi is a good choice. Then Gantharvastadi were considered to be very anilomana, like Cervilon, which can be given in the lumbar spondylosis. Then Mergundi Erenda. Mergundi is considered to be one of the single drug which is very considered to be very effective for making Vedana when it is combined with the Erenda Vaila in Kadi Kriva. Then Jadamayadi again level some level of anti-inflammatory level. Pehatu Umo, Vajar, Sadako, Jenny, Leva Shuran with Vadarakte, Vadakapoteri. When Vadakapa predominance is there, at that time Grehutumadi is more useful. We usually use, Grehutumadi with Deshamula, Deshamula Kasaya. Deshamula Kasaya is considered to be very effective in Vatakapa disorders. Then hence, when we mix this Deshamula Kasaya with Grehutumadi, it is a very good remedy for relieving pain immediately. Then for making Svedana, with making it in the quarterly. These are the anti-inflammatory management techniques, management medicines, which can be used for early stage of cervical spondylosis and lumbar spondylosis. Next, many Kriya Kramas are also this anti-inflammatory. Uddartanam can be done. Actually, the Uddartanam is Drivyasya Ardravishtasya Dehaliptasya Shushyata Pradilomam Udleka. So the Uddartanam Erikan. Uddartanam should be done like that. Drivyasya Ardravishtasya Dehaliptasya Shushyata Pradilomam Udleka. So the Uddartanam Erikan. Then Dusha Sweda. You see, when Acharya Susarva, when he is explaining about the qualities or benefits of Sveda, Agner Dipin Mardavam Taprasadam, Bhaktasratham Sodasam Nirmilatam, Kuryan Svedo Handi Nidram Satandra, Staptan, Sandhin, Cheshtaye Dashivita. Wherever Sandhi problem is there, Staptan, Sandhin, Cheshtaye Dashivita. This Sveda is very, very effective. Like you see, a joint is a place of Vata and Kapha. Yes, almost all the joint diseases are Vata Kapha disorders. Hence, that is why Rucha Sveda, Deshamvira Kashaya Thara, Lebana with Grehutomadi, all these things are very effective in osteoarthritis, lumbar spondylosis, everywhere, where we need to use this Rucha Prakriya. It's because joint disorders are always Vata Kapha predominant. But inflammation is a Pitta Anubandha. Hence, initially some Pitta level, Pitta Hara Chikitsa should be done. Hence, when we want to correct the degeneration, we have to go for Vata Kapha Hara treatment. Sweda is a Sweda Sathya Prashamyandi, Veda Vata Kapha. Vata Kapha disorder, Sweda, in all the Vata Kapha disorders, Sweda is considered to be very effective. See, when we are doing this Ruchana Prakriya in all the diseases, in any disease, not in cervical spondylosis or in lumbar disorders, wherever we use Rucha Prakriya, at a particular stage, we have to stop Ruchana. This is the Viruchane, Lenkanavat Kripati Kriparakshana. Then what is the Lenkana Samyak Yoga? Vimalendriyata Sargo. Like in that, Vyadhi Mahardava Utsaha Standra Nashastalengide. When we are using Ruchana Prakriya, Bhajana, Divana, Levana, all those things, after 3 to 5 days or 5 to 7 days, the patient is saying that I am having some level of improvement. Pain is reduced, swelling is reduced, stiffness is reduced. If the patient is saying, at that time we can stop all the Rucha Prakriyas. We can go for application of oil and other things. This is the stage, when the patient is having some level of improvement. Vyadhi Mardava. When Vyadhi Mardava is there, that is the correct point, critical point for stopping all the Rucha Prakriyas, and we can go for application of Thaila and other anti-degenerative management. See, in cervical spondylosis and diseases related with shoulder joint, Karpasasti, Bela, Masha, Pulathai, Kotite. This Karpasasti Thaila is having one very important peculiarity. Kalpana Navana Abhyanga Yoga Sapanilapakam. This is not at all, this Thaila is not at all indicated for Pasti. This Thaila is indicated for Kalpana Navana Abhyanga. Usually, Thaila Chatushprayogam Vadas, Chatushprayogas are there. But in this case, this Thaila is having only 3 prayogas. The Vasti is not at all included in the indication of Karpasasti Thaila. Then Kotanjupat Thaila can be used. Anandra Thaila can be used wherever degeneration is small. Then Ketaki Mula Veladu Velanam, Ed Bahale, Negasena Vivukam, Thailama, Alpa to Soda Yukam, Maru Astigadam Minihandi. For Astigadavada, this Ketaki Mula Thaila is good. Then Gulgul Prada, you see, one of the best and important medicine for managing the degenerative changes associated with any joint in the body is Gulgul, because in its indication, Sandhyasti Majjagadamapyada Kuttami, it is told. It is clearly told. Sandhyasti Majjagadamapyada. So, any diseases affecting the joint or Asti, Majja, the Gulgul is a wonderful combination, wonderful medicine. Then in Kerala, we always use Murugana. Murugana is also a part of a treatment. Hence, anti-degeneration treatment includes application of Thaila, intake of Thailas or Buddha, all those things for getting some level of regeneration. It is very important because for degeneration, we need regeneration. Next slide. Next, sir. Next, sir. Next. 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 You see, then we can go for next Snehapanam, Abhyangam, Swedanam, Virejanam. In Virejana is very important in Padigraha, but that it is not having. No, sir. Snehapanam, Abhyangam, Swedanam, Virejanam. Then Griva, Kadi, Piju, Griva, Kadi, Vasti, all those things can be applied. You see, Virejana is very effective in Padigraha, but it is not so effective in Griva Graha. Because, in Padigraha, some level of anilomana is occurring. Because, Padigraha usually occurs when the Pakwashe Gata Vayu. Pakwashe Gata Vayu, Tata Pakwashe Gata Shulana, Andhra Bhujanam, Balarodhasma, Trikaprashta Kadigraham, which is properly told. Trikaprashta Kadigraham is told with Pakwashe Gata Vada. Pakwashe Gata Vada is always Apanavayu. Udaram Yodayurtham, Apanam cha Anilome. Apanavayu, Anilomana is very important. Consider as Virejana is an Anilomana treatment, definitely we have to do Virejana in all the Kadigraha cases, especially with the Nirgundi Erenda, because Nirgundi is considered to be one of the best single medicine for Kadigraha. Consider if you can combine Nirgundi with Erenda, that is a good combination for making Virejana in Kadigraha patients. Abhyanga, Snehavana, all these things can be done properly. Next, importance of Sneha. That is very, very important because before conducting any kind of Virejana or classical Virejana or Vamana, definitely we have to do the Snehavana. This is importance of Snehana is Snehana can produce dosha Utklesha, dosha Shamana, Thadu Vritti, Thadu, everything, Thadu Poshana, everything can be done. Snehana is important in Dinacharya and Irdi also. Then Snehana means, Sneha Saroyam Purusha, Pranashta Sneha Bhulishta, Sneha Sadhyashta Pavandi. In this way, Susura starts the chapter with the Snehana. Next, Snehanam, Sneha Vishyanda, Mardava, Kleda Garavam. Snehanam, Vishyandanam, Mardavam, Kleda. These are the 4 qualities of a Sneha Drivya. Then indications of Sneha. I think I need not explain all these things. These are all textual reference, all these things are very important because when we choose a treatment, we have to see the artha and anartha of patients. That is very, very important. Hence, for Vrutthabala, Balakasayutha, Chidasra, Revisa, Vadarthas, all the later rogas are explained as indications for Vadarthas, Yanda, Tigara, the Ayurveda Pratibodhina. Because Sneha, especially Krida, is having more affinity towards the organ eye. That is why the eye disease responding very well to Snehapanam. Then its contraindications, which I need not go. So contraindications, sir. Next. So they are not Todamandagristi, Shishagristi, the next. See, when we have to, so before conducting Snehavana, we have to understand that the patient should have good appetite. Then, Kashayapana Pathyanir Deshahid Venkide Sapridadyan Kape Mande Vadarthokari. That is very, very important. When the kapha, due to Ruchana Prapriya and the Lenghana Prapriya, when the kapha is coming down, at that time the disease becomes Vada Vaitiga. At that time we can apply Snehana. Because Sneha, especially Krida, is always Vada Pitta Para. Consider when there is kapha anubandha, it cannot be applied. When this Medu anubandha, it cannot be applied. Appetite also we should see. Because when there is good appetite, at that time only we can apply Sneha. Then next.
Sir, കുറച്ച് സൗണ്ട് കുറവാന്ന് ചിലര് പറയണ്ട സാർ. സൗണ്ട്
ഇപ്പം എങ്ങനെയാ?
ഇപ്പൊ ഓക്കെയാണ് സാർ. ഇപ്പൊ നല്ല സൗണ്ട്.
കുറച്ചുകൂടെ അടുത്ത് വെച്ച് പറയാം.
ഓക്കെ ഓക്കെ.
അതൊന്ന് പറഞ്ഞു കുഴപ്പമില്ല. ചേർത്ത് വെച്ചോട്ടെ. പക്ഷേ കാണൂ അല്ലേ? ഇപ്പൊ കേൾക്കാലോ?
അതെ സാർ, ഇപ്പൊ കേൾക്കാം.
കുഴപ്പമില്ല. Then various Snehana, Abhyanga, Seva, Piju, then these are all Bhakya Snehas. The Abhyanga Sneha, Achabeya, Vicharana, all these are Bhakya. We are coming into the details of those things. Achabena is the Sneha alone is taken, and that is for getting good Vikrasana. Usually in my practice, Achabeya is done only for performing Vamana alone. For if you want to perform Virejana, I usually go for Mathyama Snehapana. That means Kastane Jirna Eva Ane Seva Achashutayebuhu. That is Achabaya. Samanat Sudduto Ananna Mathyamatrasta Saside. Mathyamatra Sneha, otherwise Samana Sneha is alone, is necessary for conducting Virejana. In cervical spondylosis, especially in lumbar spondylosis, we perform Virejana. Before that, we need to conduct only Shamana Snehavana. Usually, we do Snehavana with this Dhanantaram Taila or other in cervical spondylosis, and with Gulgula in all the degenerative diseases, the spine and the joints. Gulgula we usually give 50, if the patient is having good appetite, when the patient is having good appetite, at that around 9:30 morning, the patient is given 50 ml of ghee. After digestion of the ghee, we will give some light food like kanji or anything. The next day it will be increased to 75 ml. Yeah, third day it will be increased to 100 ml. And that 100 ml is continued to 7th day. And the next day Sweda can be done. And after that Virejana can be done. Like that, this is very comfortable to the patient. That is why I selected this particular dose, because it is very effective and it is very comfortable. It doesn't make any digestive issue or any pain or nothing, any discomfort to the patient. Hence, I always prefer this Shamana Snehavana to the patients. Because this Acha Snehamana is can be only indicated in for before performing Vamana. Vamana is indicated in very few diseases, especially in psoriasis, mental disorders. Such very rare cases alone are there in which Vamana we should do. But in Virejana, it's a very common disease as it is Anilomana. It can be done in any cases. If we go through the indications and contraindications of Vamana and Virejana, you can see that in the case of Vamana, indications are minimum and contraindications are more. Please listen. In the case of Vamana, indications are minimum and contraindications are more. But in the case of Virejana, indications are less. Indications are more, but contraindications are less. In the case of Virejana, indications are more and contraindications are very less. Which means that Virejana, as it is Anilomana, Anilomana is a preferable one. And as it is Anilomana, Virejana can be done in any patients, provided if the patient is having sufficient Sharira Bela to tolerate to the Virejana. That's the only thing which we have to do. In weak patients, Virejana should not be done. That is the only thing. Hence, this is the Achavaya, even though I explained, very rarely done in cervical spondylosis or lumbar losses. So then, Shastane Jirna Yavane, next read, sir. Shastane Jirna Yavane, Snehacha Shute Bahu. Then, those of the Snehama, according decided by according to age, health, prakriti, many factors are there which I need not explain. Next, sir. So the one very important theory is there. When we do Snehapana, the Sneha is going up to the Majja Dhatu. Because, that is why Sushrada says also in the case of Gurugurita Sanjasti Majjagatavapyutakutamidu. One more very important point is there. For example, when we see the Samyak Yoga Lakshana of Snehapana, Vadanilomyam Deeptogir Varchasniktam. This is very important. Varchasniktam means some level of Sneha is going from the body, going out of the body through the Varchas or fecal matter, evacuated. Because, many teachers teach that it is the body is already saturated with the fat, and that is why it is already excreted through the fecal matter. But that is not the answer. That is not the correct answer. When we see Snipta Amsha in Varchas or fecal matter, it means that, you see, when Acharya explained the Sadhu Manas, Kathapittam Malakheshu Prasvedo Natharomacha Sneho Chittagvisham Oju Adhuinam Mashomala. This means that, the Sneha part which is seen in Varcha is the Malabhava of Majjatha. Once again, I am saying the Sneha part which is seen in Varchas or fecal matter is a sign that, the Sneha has reached up to the Majjatha. Because, Kapapittam Malakheshu Prasvedo Nakaromacha Sneho Achittvamisham Ojo Adhuinam Ramashobala. This means that Majja, it is a Malabhava of Majja Dhatu. So if the fecal matter is combined with the Snektamsha, and the Sneha has reached up to Majja Dhatu. That is why in Gulguru Krita Sanjasti Majjagaramapyarakutamidil. We have to understand that this Snehapana is a very important disease, which important Snehapana treatment procedure, which means that all the medicaments which we administer through, he is reaching up to the Majja Dhatu. That is very important. Then Anubanas, Janamusnam Kradam Peye, Yushastayale, Anishasyade, Osamadyostu Mandasya, Sarveshu Usnam Arambuva. Next, sir. Next. Next. Then Hiswamatra, I need not explain this. Next, sir. Next. Snehapanam, Samagraham, I already told you, Trehamacham Murdu, in Murdu Kosta, only 3 days of Snehapanam is necessary. In Kurura Kosta, Saptadina may be necessary, but that is not the thing. You have to, because I already told you the Ayurveda is a Lakshana Shastra, these days are not at all important because the signs and symptoms which we see in the patient is very, very important. That is why we have to see the signs and symptoms. That way we have to think. Days are not at all important. Even we can continue Snehana even after 7 days before getting good Samyak Siddha Lakshanas. Next, sir. Continued till Samyak Siddha. Vadaninome, I already told that Snehodvega, then Deepto Varchas. This Varchas is very, very important because this is a subjective Lakshana. There are some subjective Lakshanas and objective Lakshanas in this. This is we can see the Samyak Siddha Lakshana in the Varchas, which is considered to be very, very important. This is also very important because in the Samprapti of Pandayoga, in Ashtanga Sangraha, it is told that when the Sriksada of the blood, Rekta is increasing at that time Pandayoga. So, which means the Ashtanga Sangraha, it is clearly told, which means that if you are consuming more Sneha, that may lead to chronic Pandayoga. Hence, definitely we have to avoid that. Next. After these are the Tathya, Ushnoda Gopajari cell. I think I need not explain. Next, sir. Next, sir. Then different Sneha Prayaga. Actually, in many cases, the patient is not at all able to consume ghee. At that time, definitely we have to go for another techniques. Usually, Sadhya Sneha is given. Levano Upahita Sneha Ityachiragaram. More quantity of krida can be mixed with Sainthavan, and that can be given to the patient with the food, like a pani or rice or anything, Definitely, that can be considered as Sadhya Sneha. Sadhya Sneha is considered to be very effective in Sneha Disha, Sneha Nitya, Hurdugosta Stayelara. For those people, Sadhya Sneha can be applied. Next. Then, Vijarna Snehavana can be given. Vijarna Snehavana means Vijarna Sneha can be mixed with ghee or food articles, and that can be given. This is Vijarna Snehavana. Next. Then usually Abhyangam, Levanam, Mardanam, Parishegam, Tailathara, Sneha, Haranam, Puranam. We usually in Kerala, this Griva Vasti, Kadi Vasti, all these things are done in patients with chronic degenerative diseases. We usually use Anandra Dailam plus Patajikadi Dailam. All those Thailas are used for doing all these treatment, that is why wherever degeneration is there, that can be arrested with giving more nutrition to the ligaments and disc. That way definitely some level of degeneration can be arrested. Then comes next Griva Vasti, retention of oil on the cervical area, Adi Vasti, Sneha Vasti. So one more very important point here I have to mention is that, if the patient is not able to consume ghee, the same ghee or oil can be administered through Vasti also, because Sneha Vasti and Snehavana are having same indications, same Samyak Siddha Lakshana, same Murdam Nasye Khare Apyange. Thane Vasta Uchikana, Snehapana and Vasti, same Paga Taila can be used. And so, if we are not able to do Snehapana in a patient, the same amount of Taila can be used for Vasta, can be used for Vasti also, as Anivasara also. The same effect we will get. There is a technique, which is not at all told in our text. But I have found out that, all the things are similar for Samyak Yoga, Paga, everything is clinical condition for a holistic Asti and Snehapana. Everything is similar, which means that, if you are not able to do Snehapana, the same Taila or Kruta can be used for Vasti also, the same effect we will get. I have seen one patient, one 7-year-old boy who is suffering from ADHD. Actually, that we are not able to give any Taira, sorry, any Krida like Kalyadaga, for Brahmi Krida, for Saraswata Krida, for nourishing his brain, we are not able to give him. Because he is not at all attending or he is not at all cooperative. Hence, we did one thing. Some 30 to 50 ml of Krida is administered as Vasti when he is sleeping. Hence, with 5 days of this Vasti, we were able to get to the effect of Snehapana with the same. Which means that, actually we did Vasti with the Kalyana Krita. In that way, Vasti can be replaced with Snehapana. This is a new idea for young students, If you are not able to give Snehapana to the patient, definitely we can manage the patient by doing some level of Vasti with the same oil which is indicated for Snehapana. Next. Next, sir. Snehapanam Prayinjida, Paga. Actually, Prajaka Pitta is acting here for absorbing the Sneha Darya which we are applying on the external part of the body. The virya of our potential drug is very also important. It is having some local action. But when we are doing Sarvanga Seka like Pidichil and everything, it is having not local action, it is having some level of systemic action also. Snehamadgiri, next, Snehamadgiri Prayinjida, Tadasweda Manandaram, Snehaswedopavannasya, Samshodhana Adhedara. At that time, we can go for some level of Shodhana. Next, sir. Then if you want, in certain cases, in cervical spondylosis, some people do Vamana, but I have never did the Vamana. I usually use Shamana Chikitsa, and then with the physiotherapy and other things, this cervical spondylosis can be managed. I have never done Vamana in cervical spondylosis, but Nirgundi Aranda is considered to be very effective for making Virejana in Padigraha patients. Next. Next, sir. Then this is a very famous Kshiravasti combination. This is the measurement, Kshiral Dau Prasutu Karyo Mathuda Ilakastraya Adena Mathidu Vasti Vadaktano Bela Varnakru. You see, if you are following the Acharya, this is the correct dose. Erandam over Kshiravaka 240 ml, Dulgiripta 120 ml, Hanandram Thailam, then Mathu, honey, all these things, this is the exact combination of a Kshiravasti. So we can change the combination, change the medicines. For example, in constipation, if the patient is very constipated, at that time, instead of Guruvita, initially we can use Kumara Krida for making the Koshta Slipta. Then we can go for Guruvita. So for arthritic pain, definitely Guluchi Kshiravaka is more effective because Guluchi is considered to be Agri Ushada for Vadaswami. Then at that time we can change the Taila. Instead of Anandam Tailam, we can go for Mathius Tailam. Wherever degeneration is more, at that time, Thymogram failure is more. This is a good combination. This is what I usually do this Vasti. I have done some thousands of Vasti, this Shira Vasti, which is not at all having any side effect. The patient is very comfortable. Even myself had undergone this Shira Vasti. I have tried in my body, considered to be very effective and especially for Padigraha and other related problems, chronic constipation, arthritis, everything. And then menstrual disorders, PCOD, all these problems, this this type of Kshiravasi is very, very effective. Hence, please write down this combination. This is very, very effective. This is because, I already told you that Yoganam Avanarpave, for avoiding the reoccurrence of the disease also, this Vasti is considered to be very, very effective. Next, sir. Then localized pain, stiffness, at that time, with Rationale Kashaya combined with, combined with the Gurugurutha and Kara is considered to be, because when in the yoga of Rasanayandadi, surface taila needs to come. Surface should be added with the Kashaya. And this is a very good combination. You see, Prasaranyadi Kashaya is considered to be very effective in radiating pain. Prasarani, Masha, Dala, Rasona, Rasana Usataihi, Prakochidan Amba. In that Kashaya is considered to be a Chira Kwaha, and that is considered to be very effective in radiating pain for Vishwachi in cervical spondylosis. But in Grithasi, the same radiating, in Grithasi is the same radiating to be lower limbs. At that time, we can go for Leshara Chira. Vadagulma Udavartam Grithasim Vishamajunam Rudrogam Vidrathim Shosam Sadhayatyashatalpaya, which means that in Grithasi we can go for Leshara Chira Paka. In Vishwaji we can go for radiating pain of the upper limb we can go for Prasaranyadi Kashaya. You see, there is a very important point here we have to note. Both these combinations contains Leshina, which means that Leshina is an inevitable part in medicine for controlling the radiating pain, especially. Then Karpasastya, I have already told you that it is not used for Vasti, but it can be applied for all the cervical related problems and periarthritis, frozen shoulder, all those problems, this Karpasastya is considered to be very effective. Next. So you see, actually we are not permitted to hold weight on our head. Nabharam Shirasa again, it is already told. But this many people many laborers are holding weight on their head, but they are not at all suffering. It's a very important thing that they are not at all suffering from cervical spondylosis. But see the other man who is sitting in front of the computer for 8 to 10 hours in a body, in a day, he is suffering from cervical spondylosis. Which means that if you are giving sufficient exercises to the neck muscles, definitely we can hold the weight on our head. But if you are not giving sufficient exercise to the cervical muscles, definitely with the wrong posture and sitting in front of the computer for many hours, definitely we will be affected with cervical spondylosis. Hence, this giving strength to our muscles is very important for maintaining the good posture. Next, sir. See, this is the intradiscal pressure. When we are lying down, the intradiscal pressure is very, very low. But when you are standing, it is 440, and when you are leaning the head, it is again high. Then when we are turning our head towards backside, at that time the intradiscal pressure is very high, which means that we have to keep a good posture. For example, when we are standing straight, at that time the intra-discal pressure is very less. Moreover, after doing work for many hours, definitely we have to lie down without a pillow in a comfortable bed, for reducing the intradiscal pressure and for relaxing the muscles related with the cervical areas or lumbar areas. Sufficient rest also should be given by lying down. Next. Then localized pain, especially in the case of lumbar spondylosis, Maharasadi Kashayam with Dhanvantaram Avarti is considered to be very effective. Then Gandharvastadi Kashayam with Inguvajadi Churana can be initially, because it makes some Padana Devana effect, and I already told that the importance of anilomana in the case of lumbar spondylosis. It makes a good anilomana, and then Maharasadi Kashayam Anantara can be given for arresting the degeneration, getting relief of the pain associated with the lower back pain. Then wherever radiating pain is there, at that time, towards the lower limbs, Sakadaradi Kashaya is considered to be very effective when radiating pain is there. But the pain is not there, but Supti is there. Supti or numbness is there for the lower limbs. At that time, Sakadaradi Kashaya can be mixed with Pinyagaraila. Hiranam Pinyagam, Panjamulam, Protecta, Pathyam Vadhapya, Megadasta, Iramapya, Shira, Ashtamsham Badi, Tenavana, Vada, the Shi, Sreshma Yukta Vishesha. This thyla is considered to be very effective for removing the Supti, the numbness. Hence, if the patient is having Supti towards the lower limbs, at that time, definitely we can use Sakadaradi Thaila along with Pinyaga Thaila. If pain is more, we can use Sakadaradi Thaila with Dhanvantaram Thaila, 101 Avarti. Then Lesher Chila, I already told you that it can be applied and be used for radiating pain or breathlessy associated with lower back pain. Next. See, the intervertebral disc lacks, actually this disc is not having any blood supply or nerve supply. It is getting nerve supply, getting nutrition from the surrounding body fluids. When we do some usual domestic work, at that time the body fluids enters into the disc and it is coming out when we are sitting down like that. Hence, always replenishing the body fluids is very necessary for getting good nutrition to the disc. Hence, we should be always moving. When we are moving, the disc is getting nutrition. When we are sitting in a permanently in a particular position, the disc is not at all nourished, by which always there is a chance of having some level of degeneration. Then treatment, then Kriyakrama. Next, all Arushana, Padana, Divana, all these Sadhya Viredana, all these treatment procedures can be done in cervical spondylosis and lumbar spondylosis. Then Kriyakramas. Next. All Udvartana, Levana, Snehapana, Bhimba, according to the clinical condition. Pattal Lakshana both is Abhyantara Vikriti Parambara, Eva Paramarthado Roga, I already told. Then there is another very good pramana in Rasa Visheshika. Idameva Prathanam Idam Neti Chikilsaya Prathanam Avastha Vitharam. This is very important. Idameva Prathanam Idam Neti Chikilsaya Prathanam Avastha Vitharam. According to the clinical condition, we have to decide the treatment, whether we have to do Kaya Segam, whether we have to do Vasti, then what is then is there any role for an osteum? Like that, Avagaha Sveda is considered to be, especially in Deshamura Kashaya, Avagaha Sveda is considered to be very effective in acute pain of lower back pain. Like that, many clinical conditions can be managed with a good supportive Ayurvedic treatment, provided the physician should be aware that, idameva pradhanam, idam neti chikilsayam pradhanam, vastabhithanam. Next. This is very, very important. Without physiotherapy, we cannot manage a lumbar spondylosis or cervical spondylosis. One of the physiotherapy texts, the chapter cervical spondylosis starts with it. Cervical spondylosis is the bread and butter of a physiotherapist. It is written like that. The cervical spondylosis is the bread and butter of a physiotherapist, which means that all the cervical spondylosis patients will approach a physiotherapist, because physiotherapy is a inevitable treatment procedure for cervical spondylosis and lumbar spondylosis. That is why, in my opinion, I am also a beneficiary of physiotherapy. I can say that 100% I can say that 2 + 2 is equal to 5. Which means that Ayurveda plus physiotherapy is having some added effect. Hence, initially we can do for IFT, TENS, ultrasound and other pain management procedures. But later we can go for muscle strengthening physiotherapy techniques, which can stabilize the joint, and thereby we can prevent the further disease problems also. In that way also is considered to be very effective. Next, sir. This is a very interesting case. See, I already told that Tattal Lakshana Bodhina Abhyandara Vibhuti Paramparayeva Ramarthato Roga. I already told. A patient came to me who is having difficulty in swallowing, associated with headache, balance issues, neck stiffness, like that, He is slightly emaciated, then tenderness over the neck and throat region was seen when personally I examined it. You see, in his MRI, see, this is very next. See, his MRI is here. Actually, you see, some level of pressing is there to the esophagus. Due to the degenerative osteophyte, the osteophyte is pressing the esophagus, and that is why he is having difficulty in swallowing. The modern doctor is advised surgery, and he is very afraid of surgery, and he came to me for getting Ayurvedic management. When I examined him, I referred him to a physiotherapy plus some Ayurvedic management also. Physiotherapy man did some traction to the cervical area, plus some muscle strengthening exercise also was given. And from my side, I used some medicine. Please, next. Next, sir. Next, sir. Next. This in my before that. So, in my side, I consider this space as a Bhaktarodha, because the patient is having difficulty in swallowing. He is not having any other problem, only some minor issues. But when we treated for Bhaktarodha, the patient got good improvement. What are the medicines I use? Indivajadurna, Trichanam Vilmanu, Adavilmutra Sangam, Kandhedandam, Ridadam, Bandurugam. You see, Kandhedandam. That particular word is there in the indication of Indivajadurna. Moreover, it is very, very Anilongana. It is explained in Gulma Chimsa of Pattamudaya. 3 churnas are explained in Gulma Chimsa of Pattamudaya. First of all, Vaishwana Churna. Second one is Indivajadi Churna. The third one is Artha Churna. These 3 churnas are very important in the management of many diseases. These are the very good medicines which we commonly use. Then Dadimadi Why Dadimadi is important? Dadimadi is a nourishing one. Moreover, it is very, very aniloman. That is why the patient was very weak. this Tadimadikara is very anti-anemic also. It is applied in the treatment of Pandurava and Athamraya. But here we used because it is very, very anilomana. Then Dhanandram Taina for Pichu over the front part of the chest, where there is esophagus. From Kanda to the some 6 inches up to the lower part, we used to do the Dhanandram Taina. Then Talagatu Nimbamrani air and the Vairam Kachuradi Gurnam is considered to be very effective in managing cervical spondylosis pain. This is very in acute pain, this Nimbamrani Amana Castro plus Kachuradi Gurnam can be used in acute pain also. Within half an hour, we will get improvement. Then Stanika Sedum for physiotherapy, muscle strengthening exercise. The patient was next rate. Within 10 days, the patient got improvement. The patient was able to swallow food without any obstruction or anything. See, this says, case study says that if you are managing the case with cervical spondylosis alone, that we may not get this much of because we use some anilomana medicine with the the use of Hinduvajadi, all these medicines help well. If the patient was able to major surgery. This is the beauty of Ayurveda. Next slide. Then here, this is a very important point which you have to understand. In Atangardaya first chapter, Bhumi Devan Sloka is there, Bhumi Deha Prathedena Deshamahu. After that, Jangalam Vai Bhuvishtam, he is explaining about the Jangara Desha. He is not at all explaining about the Bhumi Desha and Bhumi Deha Desha. Why? He is not explaining because Deha Desha already explained. Then he is going to explain. Then everything he explained, but he is not at all further explaining in that part. See, here this sloka is very important in the case of cervical spondylosis and lumbar spondylosis, because we know that same lesion is happening, but in different parts of the body. Same lesion, cervical spondylosis and lumbar spondylosis, same type of lesion is happening, but in different parts of the body. The cervical spondylosis, upper part of the body is affected, which is a kaphasthana. But in the lumbar spondylosis, the disease is affecting in a vata sthana, especially apana sthana. You see, hence this cervical spondylosis is a vata disease occurring in the kaphasthana. Hence it can be termed as a vata kapha disorder. In vata kapha disorder, the treatment principle is that kaphanibandhe pavane guryal kaphagaram guryam. We should do kaphagara treatment initially. When we are doing kaphagara, rucha, pajana treatment, definitely at that time, kapha chaya will happen, which results in the disease is becoming vata. Various parts of the body, we have to adopt various treatment techniques. That is very, very important. That is why, hence, our treatment principles are entirely different from modern medicine, because we have to do some Stanika Chikitsa also. Then hence, this is the take-home message for this cervical spondylosis and lumbar spondylosis. Even though both diseases are having same lesion, you have to adopt different treatment techniques. Thank you all.
Thank you, sir. Thank you for the wonderful presentation, sir. Yes, sir. I think everyone really enriched this session with a lot of knowledge, and I can see through this chat box also, everyone is saying that is very wonderful and useful sessions in their clinical practice also.